What we're going to do is we're going to integrate CLX for some common functional activities for knees, hips, and so forth, in particular for the lower quarter. So I want to take us from a low-level progression to a high-level progression, okay? So I'm going to have my patient go ahead and go supine here. Now, with a traditional band, we would maybe potentially tie that around, tie it in a knot, and so forth. The challenge is we want to progress our patients into stuff that they can do easily at home. So with the CLX, I can come and just create that loop, and I'm teaching them to slip that on no differently than I would if I was teaching them to put on a pair of shorts, okay? And so I'm just, again, using those consecutive loops to go through here. And so from this, I want to look at functional exercises, guys, because patients that are told to just do, for example, straight leg raises or quad sets on a table, they're leaving our offices and saying, why am I doing that? What's the point of doing a quad set on a table? I don't do that in real life. So if I can tie it into something function, like a bridge, which is just a basic functional mobility, hey, I gotta be able to pull my pants up, I gotta be able to scoot in bed if it's a low-level issue, something for a knee or for a hip, and then back down. We can use our clinical conscious, our mindset to say, hey, we can progress this from a simple concentric exercise to then working on eccentrics and that slow lowering, okay? So I'm gonna tie it back to function, which is, this is not a glute strengthening exercise or a knee strengthening exercise, this is a functional exercise, kind of getting back to bridging, okay? From there, I can have my patient go ahead and turn onto your side, and I don't have to worry that my patient's going to be tying or untying knots in a traditional band, because the loop's already there. So I can progress to a clam exercise. So again, if we're dealing with someone with a total hip, total knee, those type of issues where we're maybe having weakness of that hip, which is going to cause excessive pronation, internal rotation of that knee, this exercise in the clam, in a basic form, allows the patient to take this exercise home. So very simple, CLX, they don't have to overthink the room. They can do a bridge exercise, they can do a clam exercise, okay? The next thing we want to do, let's go ahead and slip that off, is I want to get them functional. So again, I mentioned the quad sets. We all do them, we do it with straight leg raises. But if I can take my patient functional, and I can take that CLX band, that double band, loop it around the knee, ideally then have it attached to a door anchor, okay? If you're not familiar with that, you can look that up on the website. So again, let's assume, for example, we're dealing with left side. I can loop that here. I've attached it to a door anchor, and now I'm gonna have her reproduce that quad set. She's just gonna drive that weight bearing, she's gonna drive that knee back. And I'll have her cue, again, on that distal quad. So instead of doing a quad set over a towel roll, or, you know, again, in a non-functional position, this is functional. Now, what is our patient gonna do? Exactly what we're doing here, which is we're dual weight bearing. We're probably favoring the injured leg. So what ends up happening is we put most of the weight there. So I can take this exercise as a home program and progress it. I can say, we're gonna work from a dual weight bearing, and I know, which means probably 70% of her weight's on the uninvolved leg, to cueing, have her bring this foot up on her toes. And so she still has essentially contact guard there, but she's now gonna instinctively have to put 60, 70, 80% weight bearing now on the involved leg. So again, what kind of injuries here? We could be working eccentric issues for Achilles tendinopathy, any sort of patellofemoral issue, total knee, obviously hip, and so forth. How would I progress this exercise from here? I could go to single leg stance entirely. It's now much higher level. So is my 80-year-old female patient or male patient 2 weeks post-op going to do single leg stance? No, probably not. But it gives me something to progress to. It gives me something to take that athlete level to, okay? And as a therapist, I could start biasing my angles, adding perturbation to it. So I can really take this up a notch, start getting her core activation, so forth. Again, hip, knee, anything lower quarter. How could I progress from here? Again, we're basically working on a quad set principle. I could attempt to have her close her eyes and really engage that proprioception even further, okay? This is typical. She's not ready for that day one, but you can kind of see or understand with that CLX how I can take into that progression, okay? Let's go ahead and loop that, we go into monster walks. Yep. Okay, now one of the advantages of the CLX, again, is we can train into functional positions. We're not having to tie knots and these type of things and so forth. Yep, so let's go loop and then we'll cross into the hands. So I like to, again, try to get off the table, get into those standing quad sets, things of that nature. And then I want to start looking at what is our basic function as human beings. Our legs and our lower quarter is designed for propulsion. So we're going to go forward, we're going to shift back, we're going to shift side to side. So here, we're going to engage with the upper arms, okay? And we may simply start with a little bit of just side to side walking, okay? Or side stepping. And this is, if you're not familiar with the CLX, there are literally, when you go to the website, hundreds, I think 800 exercises tailored to different regions of the body. Okay, now I know this isn't functional unless you're holding up a 7-Eleven, okay? But what it is it's weight bearing. So it is functional in that regard. So we're gonna just go from here. We're activating glute med. We're getting the knee, the lower quarter to stay engaged. Now, the hip, the knee is stability, but the hip is a mobility joint. It's designed, has a rotary component. So why not train both hips through a drop step position? So I'm having to pivot and open up, in this case on our left hip, and then having to load and land on the right leg. And so I can do drop steps here. How do we progress this? We go lower. So when our patients start showing weakness and they're way up here and they do this is what I see sometimes. I turn my back and they're just doing this, really easy. No. Drive down low, go low, okay? We'll do 10 on one side and then we'll do 10 on the other side. If we really wanna have fun with our athletes, we'll start doing clocks. Okay, and we'll go all the way around the circle. They do that 1 or 2 times, they're looking at you like you're crazy. Okay, so we're just, again, taking something, the ability of a functional activity, trying to utilize the CLX in different ways to induce more of a load. Okay, let's go ahead and slip that down to the ankles now. Now, the other thing we would look at with hip issues, even low back issues, associated knee issues and ankle issues, is basic functional walking. Guys, when I am standing in mid-stance on my right leg, I'm having to swing and weight shift on the left, okay? Which legs right now are being activated? The answer is both. It's not meant to be a trick question, and then I have to load onto the left. Same thing if I'm shifting back. Both legs are working. One's just in closed chain, one is an open chain. So taking the CLX and just telling our patients, find a safe area at home, and I just want you to work on walking. I can help have her work into that toe up position and then just loading back down. This is in a linear plane, okay? Now I can simply start adding angles to it. So if I cue her like on an imaginary clock, I could say step to 11, okay? Step to 12, step to 9. Let's cross midline. Let's create excessive internal rotation, in this case on her right foot. Let's step to 1, okay? So we can start adding closed chain functional activities. We could do step to 1, reach on the shelf, okay? Step to 11, reach on the shelf. These are just different ideas, whether you are in an outpatient setting, a sports setting, long-term care setting, that dials into the function, okay? What about the basics? And I say that with just a smile, but if we're just doing hip rotations, or I should say hip straight leg raises all 3 directions, I can go forward flexion, I can go abduction, I can try to induce and get hip extension, okay? So I can utilize the CLX in that fashion. Now, one of my favorite exercises, and I haven't even briefed her on this yet, I'm just throwing this out here right now, is that when we look at hip and knee issues and core low back issues, it's very common, guys. Every clinic in America is one of these. When have you ever seen any of us in your life walk around this trade show? When have you ever seen Yeah, I've never done that. You might. Right? I don't know. Yeah, every once in a while. But my point being is it's not super functional. Okay? So let's go ahead and flip this off one leg. Actually, go ahead. Flip that out. Yeah. Again, my goal is to try to make it into something functional. Okay? So what I like about the CLX is you're going to handle it here. We're going to work into that cross extension down. Okay, come on forward. All right, easy to remember. We're going to have this secured in a clinic setting. We're not going to conference hall with a proper CLX. Okay, so great security between the floor and the wall. Okay, you're just going to get that angle. Okay, now what I'm going to be doing is encourage you in this situation. We'll stand here. Now, we have 4 issues we can work on. But now we're going to go this okay? What are we working on? We're working core, we're working back, we're working glutes, we're working lat, we're working elbows. Okay? Not the easiest exercise. How can I progress this? I can put her on a stable surface. All of a sudden here, I can take up one notch, and I can take her into a stable surface. Now, you can see point being is not to make light of your comment, right? But you don't, every day in America, and I went around behind you, we're doing the cross arm extension. Okay? In the same way, let's go to the exercise with the CLX doesn't for the hip. We're going to introduce the stability one. I'm able to stand there. Okay? We're going to go into a basic squat. Okay? We're going to hold that. Again, like Eric was doing our morning, we're literally going to have our feet block with that CLX. Now, I'm going to have her bring her arm hands right by her chest. Guys, we are shortening the lever arm, line up and increase the lever arm. And when we break out those arms, in your lever arm, go out again. What I want you to do is hold her this way. She has to track with her core, her hips, and her knees. It doesn't make it long if I can hear it 100% that band. For her to be feeling this through her hips and her knees, I can guarantee you her big toe is trying to definitely engage into that stability platform. And then I can go from this angle, guess what? And I can obviously treat it here. So what am I treating here? I can be treating core, back issues. I can be treating this knee, foot, ankle, hip, all with one motion. I can say, hold that, hold that there. And now all of a sudden, I can be in here and I can be in there, act like I'm smart for a day, okay? And I can challenge her here. And I can say, go low, go. And we can work it. Does that make sense? Okay, 2 more things I want to show you. Guys, we work rotator cuff all day long, right? Internal and external rotation. We work up in here, we get fancy with different angles. The hip joint, if we're dealing with hip and knee issues, the hip joint is essentially, it's a rotator cuff, okay? It's a rotator. Okay. Now, in the clinic, I'm going to be honest with you, y'all have a roll tool. Okay, you guys are visualizing, I can adjust this tool to the perfect height. But here is again the spinner. Yep. I'm going to use a stability pad, we're going to put her knee on that, but I want you guys to envision, we all have them, we have those rolling tools. But we're isolating that. Take the loop of that CLX, and again, we're not tying knots, we're just simply looping it over the foot. This is secure, not tied off her hair no more, and now my patient can be working hip internal rotation. Guys, this exercise right here, what hip's working right now? Left one or the right one? Both, right? You got a stance leg and an open chain leg, essentially. So if we want to challenge her, I could put a stability pad under her right foot. These are just different ideas, okay? I can come from the other angle, and I can work in the hip here. Don't underestimate the value of isolating hip rotation. And that CLX, in all seriousness, if you have that secured off, block, and then, and I always hold the functional activities, functional squatting, okay? We're designed to squat, lift, push, pull. These are basic primitive functions, okay? And I'm a big believer about cueing basic function. So if she's doing this, I'm going to cue her maybe to go, I'm going to be watching her mechanics. I'm going to say go down lower, go up on a 1 count and down on a 3 count. Up on a 1 count and then down on a 1, 2, 3. Up on a 1 count. Good, down 1, 2, 3. Now, maybe we're getting up and we're reaching onto the shelf. So we're going to go up and reach onto the shelf, onto oblique angle, and then back down. Up and reach to the other shelf, okay? What it does is it allows us, the CLX, to do body-on-body movements like this, where we open up the hands, we're not tying knots off to the feet, things of that nature. This exercise right here, again, probably working 300 plus muscles. I mean, literally half our body it's being worked right now, okay? So the take-home message that I hopefully you guys want to see with the CLX is this. It allows us to do more things in functional activities. It allows us to do body-on-body type of activities where we're attaching it to the body, leaving our hands open. We can do more sport-specific training, but honestly, I like the fact that we can do more functional training. Okay? Those of you who weren't here earlier, we started out on the mat table and just being able to do basic functional bridging, clamps, progressing to weight bearing, single leg stance, and so forth. And I'm sure a lot of you guys have other exercises you can come up with. There's lots of different things, but I want you to think about function. Okay? Questions? All right, guys, thank you.